Every evening, millions of Americans come home from work, sit down on the edge of the bed and look at their ankles. They don't recognize them. The bones have disappeared. The skin is tight, shiny, stretched over something that wasn't there this morning. They press a thumb into the swollen flesh and hold it for 3 seconds. When they pull it away, the dent stays, a perfect thumbprint carved into their own body, filling back in slowly like memory foam, remembering a shape it was never supposed to hold. This is edema, and if you have it, you've almost certainly been told one of 3 things. Take a water pill, elevate your legs, reduce your salt. You've probably done all 3, and you're probably still swollen. Because what nobody explained to you is that those 3 instructions treat the symptom the way a bucket treats a leaky roof. The water keeps coming, the bucket keeps filling, and nobody ever climbs up to find the hole. But right now, in clinics that your doctor has probably never referred you to, holistic healers are treating swollen legs without a single prescription. No diuretics, no compression drug protocols, no monthly copays for pills that drain the fluid today and deplete your potassium by Thursday. They're using methods that address the actual mechanics of why your legs are swelling in the first place. Methods so effective, so inexpensive, and so thoroughly documented that the only mystery is why your physician never brought them up. And here's the part that should bother you. The reason your legs are swelling isn't complicated. It isn't a mystery that requires a specialist and a battery of tests. Your body is telling you something specific and readable, the way a dashboard light tells you something specific and readable. But instead of looking under the hood, modern medicine keeps putting tape over the light and calling it treatment. Before I show you what holistic healers actually do and exactly why it works, you need to understand what's happening beneath that tight, shiny skin. Because once you see the mechanism, the holistic approach won't sound alternative. It'll sound like the only approach that ever made sense. It is a Wednesday afternoon in March. A woman named Diane is sitting in a recliner in her living room in suburban Nashville. She is 56 years old. Thus, she retired from nursing last year because standing for 12-hour shifts had become unbearable. Not because of fatigue, because by hour 6, her calves felt like water balloons stretched to capacity. Her shoes stopped fitting by lunch. By the time she drove home, her ankles had vanished into columns of swollen flesh that throbbed when she walked from the car to the front door. Her doctor prescribed furosemide, a loop diuretic. It worked in the way that bailing water from a sinking boat works. The swelling went down, then it came back. So she took another pill, then another, 3 years of this. And nobody mentioned that long-term diuretic use causes electrolyte depletion so reliably that the side effects read like a medical textbook. Hypokalemia, low potassium, which causes muscle cramps, weakness, fatigue, and irregular heartbeat. The very symptoms Diane started developing 6 months into treatment. Her doctor's response was not to question the diuretic. It was to prescribe a potassium supplement. A second pill to manage the damage of the first pill. Sounds familiar, doesn't it? The cascade, the pill for the pill, the side effect that becomes a new diagnosis, that becomes a new prescription. You've seen this movie, you've lived inside it, and nobody ever pressed pause to ask whether the whole script was written wrong. Now here's where it gets interesting, because the fluid in Diane's legs didn't appear randomly. It followed a path that's governed by physics so basic you learned it in middle school. Gravity pulls fluid down. Your body has a system designed to push it back up. When that system fails, fluid accumulates. The swelling you see is not a disease, it's a consequence. Let me explain that system, because your doctor probably never did. Your body circulates fluid in 2 networks. The first is your blood. Heart pumps it out. Arteries carry it down, veins carry it back up. Simple enough. But there's a second network most people never hear about. The lymphatic system, a vast web of tiny vessels that collects excess fluid from your tissues, filters it through lymph nodes, and returns it to your bloodstream. It handles roughly 3 liters of fluid per day. And unlike your cardiovascular system, it has no pump, no heart driving it, The lymphatic system relies entirely on one thing to move fluid upward against gravity: movement, specifically your muscles. Every time your calf muscle contracts, it squeezes the lymphatic and venous vessels running through it. This squeezing action pushes fluid upward past one-way valves that prevent it from falling back. It's called the calf muscle pump, and it is the primary mechanism your body uses to return fluid from your lower legs to your core. Without it, fluid pools, tissues swell, ankles disappear. Makes sense, right? So now ask yourself this question: how many hours did you sit today? The average American adult sits for 10 to 12 hours per day. Office work, commuting, eating, television, 10 to 12 hours of the calf muscle pump doing absolutely nothing. 10 to 12 hours of fluid obeying gravity while the system designed to counteract gravity is switched off. And then you look at your ankles at 8 p.m. and wonder what went wrong. Nothing went wrong. Everything worked exactly as physics dictates. You sat still, so the pump stopped. So the fluid collected. The swelling isn't a malfunction, it's a mechanical certainty. And this is the first thing holistic practitioners address. Not with a pill, with movement, but not the kind of movement you'd expect. If you're finding this valuable, hit that like button. This is information that millions of people are missing because nobody profits from explaining how gravity works. Holistic healers don't tell you to go run a marathon. They don't prescribe an exercise program that requires gym membership and spandex. They prescribe something that looks almost absurdly simple: calf raises, ankle circles, walking for 15 minutes every 2 hours, movements so small they barely register as exercise. But these micro movements reactivate the calf muscle pump. They squeeze those vessels, they push the fluid up past the one-way valves, and the swelling begins to resolve. Not because you took something, but because you moved something that was designed to move. Clinical research backs this up. Studies on venous insufficiency demonstrate that activation of the calf muscle pump significantly reduces lower extremity edema. Raised leg exercises performed for 20 minutes 3 times daily measurably decreased leg swelling in clinical settings. The mechanism isn't theoretical, it's mechanical. It's as straightforward as pumping a well handle to draw water, but nobody handed Diane a well handle. They handed her furosemide. But here's where the story goes deeper, because movement is only the first layer. The second layer is something happening inside Diane's body every time she eats, and this is the part holistic healers spend the most time on, the part that makes mainstream physicians uncomfortable, because it implicates the food supply. The average American consumes 3,400 milligrams of sodium per day. The recommended maximum is 2,300. 9 out of 10 Americans exceed it, and 70% of that sodium doesn't come from the salt shaker on the table. It comes from packaged food, processed food, restaurant food, sodium hidden in bread, canned soup, frozen meals, deli meat, salad dressing, and 1,000 other products you'd never think to suspect. Now here's what sodium does in your body. When sodium levels in your blood rise, your kidneys respond by retaining water to dilute the concentration. More water in the bloodstream means more pressure inside the blood vessels. That increased pressure forces fluid out through the vessel walls and into the surrounding tissue. The tissue swells, your ankles disappear, and the whole process happens within 24 hours of a high sodium meal. You're not retaining water because your body is broken. You're retaining water because your body is doing exactly what it's supposed to do when flooded with more salt than it can excrete. The swelling is your body's chemistry working correctly inside a food environment that's working against it. Holistic healers address this not by restricting salt with a list of rules that feel like punishment. They address it by replacing the processed foods that carry hidden sodium with whole foods that are naturally low in sodium and high in the 2 minerals that directly counterbalance it: potassium and magnesium. And this is where the story takes a turn that should infuriate you. Potassium and sodium exist in a seesaw relationship. When potassium is adequate, your kidneys excrete sodium more efficiently. When potassium is low, sodium lingers. Fluid lingers with it. Magnesium operates the cellular pumps, the sodium-potassium ATPase pumps. that regulate fluid balance at the cellular level. When magnesium is deficient, those pumps malfunction. Sodium accumulates inside cells. Water follows sodium. Cells swell, tissues swell, legs swell. Over 50% of American adults don't meet the recommended daily intake of magnesium, and most Americans consume barely half the recommended potassium. You are living inside a nationwide mineral deficiency that directly, mechanically, biochemically causes fluid retention. And instead of correcting the deficiency, the standard medical response is a diuretic that forces your kidneys to dump water along with what little potassium and magnesium you had left. Read that again. The pill prescribed to fix the swelling depletes the exact minerals whose absence is causing the swelling. This isn't a conspiracy. It's something worse. It's a system that never bothered to look upstream, a system that treats the puddle on the floor without ever checking whether the faucet is still running. Holistic healers check the faucet. They run mineral panels that most GPs don't order. They look at potassium and magnesium levels the way a mechanic looks at oil and coolant, as fundamental fluids that must be correct before anything else will function. And when they find the deficiency, which they almost always do, the correction is not a pill. It's a plate, sweet potatoes, avocados, spinach, white beans, bananas, salmon, pumpkin seeds, dark leafy greens. These aren't exotic superfoods. They're the foods your grandmother ate without being told they were medicinal. They're loaded with potassium, magnesium, and the anti-inflammatory compounds that reduce the vascular permeability, allowing fluid to escape into your tissues in the first place. But holistic healers don't stop at the plate. They go one layer deeper. And this is where ancient wisdom meets modern anatomy in a way that will make you wonder why this isn't standard care. The lymphatic system has no pump. We established that. But it does have something. It has a map, a network of pathways and nodes concentrated in specific areas of the body: the groin, behind the knees, the abdomen. And for centuries, traditional healers have used manual techniques to move lymphatic fluid along those pathways when the body's own pump has stalled. Modern clinical research calls it manual lymphatic drainage. Randomized controlled trials have demonstrated that it reduces edema in post-surgical patients, ankle injury patients, and individuals with chronic lymphedema. One clinical trial showed significant decreases in limb volume and pain. The technique involves light, rhythmic pressure far lighter than a conventional massage, applied in the direction of lymph flow. The practitioner isn't pushing fluid through muscle. She's coaxing it along channels that are already there but aren't moving fast enough. This isn't mysticism, it's fluid dynamics applied by hand. And holistic clinics have been offering it for decades, while conventional medicine prescribed another round of furosemide. Then there are the herbal allies. Dandelion leaf. A 2009 pilot study at a university research center found that dandelion leaf extract significantly increased urinary frequency and the output, the classic definition of a diuretic effect. But unlike pharmaceutical diuretics, dandelion is naturally high in potassium. It promotes fluid excretion without depleting the mineral that prevents fluid retention. It gives and it takes simultaneously, a balance so elegant that if a pharmaceutical company had invented it, they'd charge $200 a month for the patent. Instead, it grows in sidewalk cracks, for free, and nobody told you. Parsley follows a similar logic. Animal research confirmed its diuretic mechanism, most specifically an inhibition of the sodium-potassium pump that promotes sodium and water excretion while retaining potassium. Traditional herbalists have prescribed parsley tea for fluid retention for centuries, not because they understood the molecular mechanism, because they watched it work over and over, generation after generation, long before anyone had a lab to confirm what observation had already proven. And then there's the simplest intervention of all, the one that costs nothing, requires no practitioner, no supplement, no purchase of any kind. Elevation, legs above the heart for 20 minutes, 3 times daily. Gravity, the same force that pulled the fluid down, now pulls it back up. Clinical evidence confirms significant reduction in lower extremity edema with this protocol alone. 20 minutes, 3 times, free. So let me tell you exactly what holistic healers are doing that your doctor isn't. They're activating the calf muscle pump with simple movements every 2 hours. They're correcting potassium and magnesium deficiencies that your physician never tested for. They're replacing hidden sodium sources with whole foods that resolve the mineral imbalance at its root. They're using manual lymphatic drainage to physically move stagnant fluid through the system your body already built for that purpose. They're prescribing herbal diuretics that promote excretion without depleting the minerals you need. And they're using gravity itself, free and infinite, to drain what accumulated while you sat still. None of this was hidden. Every mechanism I described is in the medical literature, published, peer-reviewed, available to anyone with a search bar and the curiosity to use it. The studies exist, the physiology is clear, the interventions are cheap, accessible, and effective. The problem was never a lack of evidence. The problem was that none of these solutions generate recurring pharmaceutical revenue. Calf raises don't have a sales force. Sweet potatoes don't buy advertising during the evening news. Dandelion grows in your yard and nobody can charge you a copay for picking it. Diane in Nashville didn't need furosemide. She needed to move her calves, correct a mineral deficiency her doctor never tested for, stop eating sodium disguised as food, and let gravity finish the job 3 times a day for 20 minutes. Her body wasn't broken. Her instructions were. And if you're sitting right now with ankles that vanished hours ago, pressing your thumb into skin that holds the dent a little too long, understand this. The swelling is not a mystery. It's a message. Your body is telling you it needs movement, minerals, and real food. It's been saying it every evening for months, maybe years. And instead of listening, someone handed you a pill that silenced the message and called it treatment. Holistic healers listen. That's the difference. Not a different ideology, not a rejection of science, just a willingness to ask why before reaching for what. And the answers they find, every single time, turn out to be simpler, cheaper, and more effective than the prescription that was supposed to make the question unnecessary. Your legs aren't failing you. The system that was supposed to explain them failed you. Now you know what it didn't teach. And tomorrow evening, when you come home and sit on the edge of the bed, you have a choice: the same bucket, or the ladder that finally takes you to the roof. The hole was always fixable. You just weren't given the ladder.